Mr. President, last month, Republicans in the House of Representatives passed a health care bill. They call it the American Health Care Act. It has been widely described as cruel and poorly crafted, and last week, President Trump described it as mean. The House bill, by design, would take health coverage away from tens of millions of Americans. It ends the guarantee of affordable coverage for people with pre-existing conditions. It cuts Medicaid, the principal program for insuring children, people with disabilities, and seniors in nursing homes. It cuts Medicaid by more than $800 billion. And to compound that cruelty, the same legislation gives an enormous tax cut, over $30 billion, to those at the top of the income scale. Now, we just heard this morning some of what's in the Senate bill, the Senate version of the American Health Care Act. And in fact, not only does it not do what President Trump claims the Senate was working on, doesn't address the mean aspect of it, but it actually makes it worse. Because in a state like New Hampshire, it provides for even deeper cuts to our expanded Medicaid program, a bipartisan program that provides for treatment for substance use disorders for people with dealing with the heroin and opioid epidemic, and it would tax older Americans more than younger Americans for their health insurance and defund Planned Parenthood. There are all kinds of reasons it would eliminate the requirement that people with pre-existing conditions are able to have health care coverage. And all of this was done in secret, behind closed doors. My office has been deluged with messages from constituents who oppose the Republican leader's bill. This shows who we've heard from. In recent weeks, I've received more than 5,400 messages opposing the bill and 108 in support. So 5,461 in opposition, 108 in support. Now, I'm sure that my colleagues on the other side of the aisle must be receiving similar volumes of mail, phone calls from their constituents, and they're hearing what I'm hearing from my constituents, that if we go forward with this legislation that the House passed, that the Senate is considering, we are going to have people who lose their access to health care and many people who have to pay more. So I appeal to Republican leaders. I urge you to stop and reconsider what you're doing. And I want you to listen to some of the people we've heard from in New Hampshire, people, everyday Americans whose lives would be devastated by this legislation. Several months ago, I asked people across the state of New Hampshire to tell me their stories about the Affordable Care Act, to tell me their concerns, to let me know how it's made a difference for them. And here we see one of the people that I've heard from. This is Diadan Batari and her son Bodie. They live in Concord, New Hampshire. And as you can see, Bodie is in a special chair there. Diadan writes, "Our 3-year-old son is a bright, curious, funny little boy who also has spinal muscular atrophy. That's a degenerative neuromuscular disease that causes his muscles to be very weak. Our insurance initially denied coverage for his wheelchair," Diadan tells me, "but because of the Affordable Care Act's ban on discrimination against those with pre-existing conditions, my son is now able to explore his world independently." She goes on to say, "I've read news reports about the Republican legislation, and I fear for our ability to maintain not just insurance coverage, but the type of quality coverage my son's life depends upon." Now, next we have a picture of the McCabe family. They're from Kingston, New Hampshire, and this is their story. I quote, what they told us. Our daughter Ellie was born with a rare and serious heart defect called hypoplastic left heart syndrome. You can see Ellie there. She looks like a healthy, inquisitive little girl. And she's looking healthy because Ellie underwent her first surgery when she was just 3 days old. The McCabe's go on to say, "It terrifies us to think about what would have happened to our family if Ellie hadn't been protected by the pre-existing conditions protections in place thanks to the Affordable Care Act. Without those protections, either we would be in serious debt for the rest of our lives, or Ellie would not have had her life-saving surgery." Now, next, this is Dr. Marie Ramos. She serves at the Lamprey Healthcare Center in Nashua, New Hampshire. That's a clinic that I just recently visited. And she writes to me, "I have a 24-year-old patient who was born with a congenital condition that didn't allow his leg bones to grow completely. This patient was unable to afford proper care, and he'd been walking with an old prosthetic for the last 3 years. Imagine not being able to get your prosthetic replaced for 3 years. But thanks to expanded Medicaid and to the ACA protections for those with pre-existing conditions, he's now getting quality care and he can afford a new prosthetic. So his life has been changed by the Affordable Care Act." I've also heard stories from scores of entrepreneurs and small business owners who have benefited from the Affordable Care Act. This is Steve Roll of Keene, New Hampshire, and he writes, "In late 2015, I left my job to start my own business. I've built a profitable business and expect to hire employees within a year or two. Before the ACA, I wouldn't have taken the risk to start a business because I have a pre-existing condition, and I wouldn't have been able to get an individual health insurance policy. If the ACA is repealed, I'm concerned that I'd need to put my business on hold in order to go back to a corporate job just to get health care benefits." Well, the health care legislation that has been produced by the Republican leadership in the Senate would take away that requirement that people with pre-existing conditions have to have access to health care. Now, we have another business person here, Dave Lucier. He's the owner of Claremont Spice and Dry Goods in Western New Hampshire. And Dave wrote me this: "Before the Affordable Care Act, insurance costs were more than a third of my business expenses. Now they're less than an eighth. The ACA made it possible for me to go out on my own and realize my dream of starting a small business here in Claremont." And his business is doing well. Many women have written to me about how the Affordable Care Act has ended discrimination against them by the health insurance industry, discrimination because of their gender. In particular, they're grateful that the Affordable Care Act includes maternity care and contraception among the law's essential health benefits. This is Maura Fay of Exeter, New Hampshire. I talked about her last night when I was talking about the impact of this Republican bill on women's health. Maura writes, "My husband and I are self-employed. Before the ACA, we were paying rates that were simply unsustainable for a middle-class family like ours. When I was pregnant in 2013, we were forced to pay a maternity rider of an additional $822 a month. I'm worried about the rollbacks and regulations around essential health benefits, especially since so many of them impact women. Maternity coverage shouldn't come with an additional $800 a month price tag." Well, Mr. President, here in Washington, some folks seem to think that repealing the Affordable Care Act is all about politics. It's about winning this debate. But for ordinary people in New Hampshire, people like Maura, like the McCabe family, like all the people that I've shown pictures of this afternoon, for ordinary people in New Hampshire and across America, repealing the Affordable Care Act isn't about politics. For so many of them, it's about life and death. It's about the kind of lives they're going to lead. It's about whether they're going to be able to continue to afford health care, whether they're going to continue to be able to pay their mortgage, buy prescription drugs. We need to listen to these ordinary people in each of our states whose lives and financial situations will be turned upside down if the Affordable Care Act is repealed. You know, this process has really been not in keeping with our democratic process in America. For the Republican leadership here in the Senate and before that in the House to pursue a partisan approach to health care, to deny Democrats, to even deny many of my Republican colleagues the ability to engage in writing of this bill, it's deeply misguided. To deny the public access, to deny a hearing on this bill. Legislation that we know is going to hurt tens of millions of Americans. There really is a better way forward for both the Senate and for our country. If we put ideology and partisanship aside, if we work together, we can strengthen the parts of the Affordable Care Act that aren't working. We can continue Medicaid expansion so it helps those people with substance use disorders, so it helps those kids with disabilities, so it helps those elderly people in nursing homes. We can fix what's not working. We can improve on this law and make it better. But we can't do that if we continue to be divided up in our partisan sides, if we're not willing to talk about the issue, not willing to work together. The American people want us to work together here in Washington to address their concerns. Well, it's time to respect their wishes. Let's strengthen the Affordable Care Act so that it works even better for all Americans. Thank you, Mr. President. I yield the floor.